Okay, this is the first lecture on diabetes treatment. Be sure, if you haven't already, to review the lectures on diabetes, just kind of the definitions of diabetes, the types of diabetes, complications, and then assessment and general overview of treatment. So I won't focus too much on the general aspects here. But in this lecture, I'll talk about the treatment, looking at the therapeutic order, and focus in specifically on some of the specific diet, exercise, lifestyle recommendations we can make, micronutrient therapy, and then say a bit about herbal therapy. And then in the following videos, we'll look at the hypoglycemic agents and insulin therapy. So I already went over this slide essentially in the last lecture, so I'm not going to go over it all again. Again, we're always interested in establishing our level of treatment using the therapeutic order as naturopathic or adjunctive care Chinese medicine practitioners. And so we need to look at, what kind of diabetes the patient has and then what level they're going to need to be initiated at. So again, type 1 diabetes, we're going to start right with replacement therapy, insulin, either with a basal and then adding maybe a bolus insulin with time. But for our type 2 patients, especially with A1Cs under 7.5, or 8%, we might look for just doing level 1, level 2 therapies, diet, exercise, lifestyle, or herbal therapies, acupuncture, hydro, etc. And then level 4 would be for more elevated A1Cs, patients who are not responding to the maybe 3-month intervention of level 1, level 2 therapies. We might add in various oral hypoglycemic agents with potentially some cardiovascular agents as well. So let's look in detail at level 1 and 2 in this little section here. So in terms of level 1 and level 2 treatment, in terms of diet, the Mediterranean diet has actually been the most studied for diabetes, and the kind of general features of that diet are, number 1, to limit caloric intake, but also generally a lower carb, low glycemic food, so higher glycemic or low glycemic foods like whole grains, things like that, as opposed to simple sugars. Good fats, omega-3 fatty acids, things like fish, especially cold water fish, nuts and seeds, flax. Flax can have some issues because it definitely does increase estrogen, so it's phytoestrogenic. And in some patients, we might not want that to happen, so we have to look at that, same as soy. But the good oils, we know, are definitely beneficial for lowering triglycerides and for cardiovascular protection. Increasing fruits and vegetables, that's really the basis of it, is a high vegetable, plant-based diet. Removing processed and sweetened foods, and then decreasing caffeine potentially. Now, coffee often gets a bad name. We used to think coffee raised blood sugar, but because there are many other polyphenols and protective compounds in coffee, we think coffee actually has a protective effect on blood sugar metabolism, on endothelial function, and so forth. So coffee still seems to be fine. It's just straight caffeine, especially any sugary drinks that have been caffeinated. That's definitely not considered to be a good therapy in diabetes. And again, most of what I'm talking about here with the level 1, level 2 is going to be applicable to type 2 diabetes more so than type 1. Intermittent fasting, this has to be approached in a diabetic patient with some care, and I won't go into kind of the details around that, but just know that most patients with diabetes are going to need higher monitoring when they do intermittent fasting. And they might need to do shorter regimens than what is typically recommended. Removal of pro-inflammatory foods like gluten grains, dairy, soy, and maybe nightshades, other things, are often recommended, but there's not a whole lot of data suggesting that that's having beneficial outcomes. Exercise, I mentioned already, aerobic and anaerobic in the last videos. Kind of a baseline might be 30 minutes 3 to 4 times a week of moderate to even vigorous exercise. That's probably a little bit over what as I mentioned, the guidelines are suggesting for cardiovascular protection, but that's maybe a good starting point to talk to your patients about. And then there's some questions about, could interval training, where we really do repetitions trying to get our heart rate up to a certain limit and then drop back down to rest, back up again several times, does that actually have a better conditioning effect on the body? And there's still debate about that. Lifestyle, and we know that sleep, of course, is very important for the melatonin regulation. So that's important to check in about with your patients, together with cigarette smoking cessation and alcohol reduction. So far, no data on marijuana and its effects on diabetes. So we'll have to look at more longer term studies with that. But definitely we know that with nicotine, we have a worsening of insulin resistance over time. Stress reduction and mindfulness practices all seem to be helpful for just reducing the stress response. So that would be kind of general level 1 therapies. Micronutrients could be used for general health, but also supporting specific organ functions. And there's several that have been studied or that are recommended in diabetes care. Not a lot of robust research around a lot of these, but some of them actually do. So, for example, alpha-lipoic acid has some studies looking at peripheral neuropathy. Generally, the studies that were done were looked at intravenous ALA, but oral as well seems to have a role. Acetyl L-carnitine for improved glucose utilization, especially in the brain. And then L-carnitine, inositol, myo-inositol, really they're the same thing. So inositol, myo-inositol are the same thing. And then berberine, I put that here, it's really an herbal product, but berberine is kind of emerging as a very interesting agent to improve insulin sensitivity, to also decrease lipids, especially LDL cholesterol. And that's typically taken at 300 milligram TID. Now, this is an example of how in traditional medicine we would never give a single agent like this without combining it with synergistic herbs to prevent some of the potential adverse effects. Berberine is considered at this dosage to be a very cold cooling remedy, and that can actually exacerbate a lot of GI functions. I've seen most commonly people will develop constipation from this, but I've also had patients say they got really bad stomach cramps and whatnot. So I typically use berberine in an herb like Mahonia, Hydrastis, Coptis, combined with other herbs to mitigate some of those cold effects. So it's really going to depend on the sort of pattern differentiation, tissue state of your patient, what kind of formulation is going to be best for that patient. Different minerals, chromium picolinate is kind of emerged as a insulin sensitizer. The studies are a little bit mixed, but there seems to be some benefit at a very, very low dose, 200 micrograms, not milligrams. And this is chromium picolinate. Now, you probably heard of hexavalent chromium. That's the toxic stuff in nature. I think that's what Aaron Brockovich was doing a lot of litigation around. This is the chromium picolinate is not toxic, and again, it's taken at a very small dose, but it seems to improve insulin sensitivity. Zinc, 15-30 milligrams. Zinc is needed in the pancreas, and so it's suspected we can maybe use zinc to help. Same with magnesium. And vanadium is sometimes also used for improving insulin sensitivity, but there are some studies indicating toxicity at a pretty low dose, so I don't typically recommend vanadium, but it is in a lot of supplements that are used for glucose lowering and so forth. Different vitamins, B complex, vitamin D are often recommended. Again, mixed evidence there. And then the essential fatty acids, the omega-3s. That'll be some of the most commonly prescribed micronutrients for diabetes, and then some of the consequent effects like peripheral neuropathy. B1 in particular we see with peripheral neuropathy, as well as B12. There is a form of B1 that is very lipid soluble called benfotiamine, and that's kind of emerged as a supplement for peripheral neuropathy. I think, again, the evidence is still mixed on that one, but that might be something to consider with ALA, alpha-lipoic acid, in diabetic patients with peripheral neuropathy. Okay, so that's a little summary of level 1 and 2. In the next slide, I'll talk a bit about the herbal therapies, part of level 2 therapies. Now, choosing herbal therapy for diabetic patients is a complex matter, and I can only cover a little aspect of it here. But suffice it to say that we can start as kind of a first starting point with herbal therapy in using herbs that address either the exocrine or the endocrine pancreas. So exocrine pancreatic herbs would all increase pancreatic enzyme secretion. They could also potentially improve beta cell function, and that would include gentiana, garden angelica, blessed thistle, atractylodes, wormwood, golden seal, Oregon grape. Again, both of these have the berberine, fennel, ginger, and cardamom. And typically these are quite bitter, and they're taken usually in low doses. Now, a lot of earlier books talked about how you had to taste these for them to work internally. The new data suggests that we have taste receptors all throughout the gut lining, so we don't have to actually consciously taste these for them to have an effect. But they, again, will have an activity to increase the secretions of the pancreas, increase the vagal nerve function, and so forth. The endocrine pancreatic herbs I've put here are thought to be insulin sensitizers. And that would be things like prickly pear, gymnema, cinnamon, bitter melon, the jambul or java plum, Syzygium cumini, the holy basil, fenugreek, and juniper. These all have various levels of evidence. Some of them are just anecdotal, like the juniper was famous herbalist John Christopher. This was one of his favorite diabetes remedies and had some interesting anecdotal stories around it. But I don't know of any research yet looking at juniper berries and diabetes. Interestingly, countries in the Middle East like Iran does put out a lot of studies on these, and because diabetes is becoming such an issue in India and the Near East, and so that's where some of the universities there are really trying to look for natural products to help with insulin sensitizing. So you can look at the literature for what the current kind of status is on that. So these herbs would address essentially the pancreas and either the endocrine or the exocrine side, as well as the insulin receptors on the tissues. But we have other factors that can occur in type 2 diabetes. So let me just focus on type 2. And that is, that we can have an overactivation of the HPA axis with an overactive stress response. That's a pituitary problem, really. And that's going to require more adaptogenic herbs like sedative adaptogens like ashwagandha and whatnot. And so that's where that would be a different set of herbs to deal with that. You might have thyroid issues, and that's why you might need thyroid sensitizing herbs as part of the treatment. There might be a high sympathetic stress response with poor sleep. Maybe nervine herbs to address the pineal and melatonin would be indicated. And then there could be low DHEA or maybe low androgens, which would be contributing to a patient's diabetes, and those would be needed to address. So the first thing I do before giving herbal therapy is not say everyone with diabetes needs these pancreatic type herbs or insulin sensitizing herbs. They need potentially herbs to address their pituitary, HPA axis, their gonads, adrenals, etc. So I make that differentiation first, and then once I know that, and that's based on their history, physical, maybe some lab findings, looking at the hormone levels, and then add in the appropriate herbal therapies with that. That's really working to the neuroendocrine system. You can say you can also support organ systems. So specifically, if we have cardiovascular issues, maybe herbs for the cardiovascular system, the digestive system, liver, gallbladder, and so forth. I typically will start here at the neuroendocrine level and then here only secondarily. And it's not uncommon where I often find myself giving herbs for this and this at the same time to kind of help synergize the activity. Okay, so that's just a very brief introduction to how we can maybe start to think about herbal therapy in our type 2 diabetic patients. So that's a quick summary of level 1 and level 2 on the therapeutic order. In the following videos, we'll look at level 3 and 4, and specifically all of the different oral hypoglycemic drugs and insulin therapy.